Hi there, it's Dr. Hatt coming to you for our next session of Chat with Hatt. Today we're going to talk about osteoarthritis. So arthritis is a disease process that I just want to bring to light for some of our older pets. More typically is when it's seen, but we're going to just kind of shed some light on the entire disease process. So let's begin. Thanks for being here. I really appreciate it, and I hope you've had a really great April. So as we get into it, as far as osteoarthritis, what is osteoarthritis? Osteo is the root word for bone. Arthritis is an inflammation of the joint. So that should kind of pinpoint us to, on our animals, we're thinking about their knees, their elbows, shoulders, wrists, also known as a carpus, or ankles, also known as a tarsus. Okay, this also does not exempt the spine and the neck. So you should probably be able to relate to this on your own body, that we also can develop arthritis in our elbows, shoulders, neck, spine, hips, knees, all of it, ankles, wrists. And so depending on how much use they get, right? Well, a dog tends to advance in age physically at a much more rapid rate, sometimes 5 to 6 times, I think even up to 7 times faster than a human. So if you take 1 year of life in the dog, their body is actually working at a rate that is almost 7 years more than you are. So this is part of why we even talk about annual blood work, that type of thing. But let's focus on arthritis today and why it's so important. What it does is use over time on these breeds of dogs. This happens in cats as well. Okay, so we'll touch on my little feline friends here in a moment. But for the dogs, I'm just going to kind of read through here. There's a cycle of joint damage. It starts from pain, sometimes from a trauma, or it can just be from use over time. And then that pet tends to sleep more. They tend to rest more, so they have reduced mobility or use, okay? Then the muscle starts to atrophy, and normally the muscle is there to really help support that joint. And the joint stability starts to wane a little bit or decrease, and then starts to decay. The joint fluid itself can actually start to carry a little bit more inflammatory cells in it, which starts to attack at the cartilage in the joint. So one of the big no-nos that I want to bring up, and one of the myths that I'd like to address right away, is a lot of pet parents really see some of these signs. Congratulations for that, but they will reach for the aspirin bottle. Aspirin actually is detrimental to joints in dogs over time. It does not actually, it may address the pain, but it doesn't help the joint. So this is where we want to really protect the cartilage at that point in time, rather than just address the pain only, okay? And your dogs love you, they are faithful to the end, so you're giving them that pill and great, they feel better. But what I'll often hear is, yeah, they move around okay, but they're old. I'm old too, and so you'll hear that, but actually your pet can be mobile its entire life if we take care of it right from the beginning. So what signs do you look for to even notice? I touched on the dogs a little bit. They sleep a little bit more. What you'll also notice is they're a bit more hesitant to maybe bend down to the food bowl or jump up on the couch. They also will be stiffer to sit. It takes them a minute to sit down, or it takes them a minute to stand up and get their legs underneath them, and they'll stand for a moment before starting to take those first steps. Cats will hesitate to jump up and hesitate to jump down. Typically, they can take a leap from a counter down to the floor or vice versa, but if they're feeling a bit arthritic, then they will put their paws down the side of the wall of that counter and kind of take it at a gradient and then jump down. Or you'll notice they will jump up to maybe the chair, take a minute, then the table, take a minute, then do sort of a horizontal leap to the counter. And so these are just some things to watch for. Cats sleep all the time, but these are little things you can notice with them. Also, the muscle atrophy is another thing. So atrophy means the shrinking or getting smaller of a muscle, all right? So you'll see those hind legs that used to look like those robust, I call them turkey legs in the back, you know, they're nice and full, and all of a sudden they start to look a bit sunken. They look a bit narrow. The ankles or the bottom of the legs start to kind of angle in, and the same with the knees sometimes, or the knees will turn out. And so these are some signs to look at as far as the posture of your pet and also the behavior of movement. How does this even happen in the first place? My dog used to be so active. Well, this is when I have to use the analogy of you as a young adult or young person compared to where you are over the age of 40. You can all remember, you know, back in the glory days when you got to be in sports, you could run, you could, you know, just jump up, you could play all day in the park, go to bed, wake up the next day and do it all over again and not even stretch. And now you're over 40 and all of a sudden you just can't move quite as well as you could have, or you played sports, or you played tennis, you hear tennis elbow, or you hear shoulder pain. And so all these things are starting to happen, and it's exactly the same. We didn't invest in our joint health at a younger age, and so now we're paying the price for it. So we can take care of our dogs a lot sooner. So when do you start protecting your pet for joint disease? One of the things that you can do is pay attention to the breed that you have and the lifestyle that you have. I really enjoy asking our pet parents, what are the plans? Are you going to take this dog hiking or camping? Do you like to go walking? You know, any activity that's honestly going to be over 3 miles of activity is a dog that's using its joints all the time, is a person that's using their joints all the time, okay? And so in doing that, it's really good to start them on a nice joint health program as early as 8 to 12 weeks. So I'm hearing this for my Labradors, for my hunting dogs, for my working dogs that are out, you know, herding sheep or cattle or getting out on the ranch and doing their thing, as well as my hunting dogs. Even though that's sometimes a seasonal activity, we still got to protect those joints all year round. And so there's a lot of different joint health protectors you can do. Some of it is dietary. And the big thing is they're discovering is that the omega-3s are really important for joint health, muscle health all together, and really improving the content of the joint fluid. Then there's also glucosamine chondroitin that's helping enhance the cartilage. And so there are a lot of big proven research now that a 6-week plan or a 6-week trial of using glucosamine chondroitin with MSM, which what is MSM? MSM. It's a supplement for inflammation. Okay. MSM is an added ingredient that is used a lot in human joint supplements, and what that does is actually help inflammation. So hear what I'm saying here. We're talking about omega-3s for muscle health. We're talking about glucosamine chondroitin for cartilage health, and then we're talking about MSM, which is a super complicated word that you won't remember, and that's why I don't. I just know what it does. Is for inflammation mainly, okay, to really protect that joint as long as possible. But now let's advance. So we've started it, and let's talk about those side effects. Because of those omega-3s and all of those supplements, you are adding more oil to this diet. So the typical side effect is soft stool. So you may have to kind of taper it down or just kind of pay attention. Some of these working breeds, like my German Shepherds and all those, have very sensitive tummies. So you do have to kind of watch how you're feeding that, okay? And make sure that you're working, and talk to your veterinarian, please, because some of these, if you have a pet that has some food allergies, may have issues with certain supplements. So always run by your choice by your veterinarian. Your veterinarian will have a lot of great choices, but there's a lot over the counter too. So just want to make sure that you're trying to do good for your pet. Collaborate with your veterinarian because you're both on the same team. So So now what's available once your pet is older? So what's great is there's wonderful, wonderful choices out there, and I know there's going to be more to come. There are glucosamine injections available now. There's even stem cell available now, which your veterinarian knows a lot about. Well, they will actually harvest some of the fat tissue during a surgery. Let's say during a spay or something like that, something that has nothing to do with this, and they will save those stem cells, which are the original cells from your dog in their youth, and they can actually inject that or get it supplementally into those joints, and it has actually reversed liver damage, arthritis, joint issues. The medicine is absolutely incredible, extremely cutting edge. So find out if there are specialists or even general practice veterinarians in your area that do this, and so that's very wonderful. The other thing that is available is cold laser therapy, and that is what that does is it's honestly, it looks like a big red light, which you're never supposed to look into, but it just looks like a light, and it was commonly used in horses. And what it does is it helps accelerate good cell growth. So it squashes those, it basically depopulates the inflammatory cells and builds up the army of good cells. And we have seen animals that cannot be on pain pills, cannot be on anti-inflammatories, still have an incredible quality of life. I'm talking my 15, 16-year-old dogs that come in for their laser therapy 2 to 3 times a week, and then it can taper down from there, but 2 to 3 times a week for the first 2 to 3 weeks, and then we start to have a taper plan. We just let the dog and their mobility tell us what's needed, okay? And they'll get their glucosamine injection and their laser therapy, and those dogs are jumping again. They're excited to go for a walk again and chase the ball, or go and jump in the car, or jump out of the car, when before all they did was just sleep all day. So be a best friend. May is Osteoarthritis Month. May you be the best friend for your dog to identify these signs, because even though they're 7 or 8 years old, even if they're 8 weeks old, they still have another 10 to 15 years more of wonderful life and companionship with you, to be able to walk with you, be that coach with you, to get you out for your walk, because you probably need it too. I'm seeing a lot with this COVID weight, let me tell you. So let's get going, make it a great summer, and we look forward to helping you give your dog its best life. And cat, let's not forget the cat. Your cat, the most perfect life. There we go. Thanks for joining me for Chat with Hatt today. I really enjoyed sharing all this information with you, and please let me know if you have any questions, or please reach out to your veterinarian if you have questions. We know how much you love them. We love them too, and thank you for doing so.